Tumor and stroke involving the labyrinthine artery are two common causes of vestibular dysfunction. Two diagnostic tests to assess vestibular functioning are the rotation chair and the caloric stimulation assessments. The doll's eye reflex is used to evaluate the functionality of the brainstem in patients who are in a coma or who have experienced traumatic brain injury.
I'm going to demonstrate to you the doll's eye reflex test. By doing this, we are going to evaluate the functionality of the brainstem with a patient who has experienced a TBI, a traumatic brain injury, or for patients in a coma. So we are going to do this by, the patient was laying on his back in the coma, you're going to take your fingers and open the eyelids, and when you open the eyelids, you're going to turn the head laterally side to side or vertically up and down. When doing this, the eyes will move in the opposite direction of the head. So if I move my head to the side, my eyes will go in the opposite direction. By doing that, that is a positive reflex. We got exactly what we wanted, the eyes went in the opposite direction of that movement of the head. So in this case, the brainstem is functioning normally. In abnormal or negative reflex test, what is going to happen is that the eyes are going to stay stationary, fixed on a spot off in the distance, and when you move the head side to side, the eyes are just going to stay straight on. So I can demonstrate this with a baby doll, just like the test is with a doll reflex. So as the eyes are fixated on front and I turn the head to the side, the idea is that the eye always stays fixated straight on. In this case, it means that there is a midbrain injury, which is involving the ocular cranial nerves, and there is a problem. So I hope this was helpful in demonstrating a vestibulo-ocular reflex.
I am going to be showing a demonstration of nystagmus as a result of a caloric stimulation assessment. A caloric stimulation assessment is used to differentiate a bilateral cortical lesion or a frontal lesion with a brainstem injury in patients who have experienced traumatic brain injury or patients who are in a comatose state. In caloric testing, the external ear canal is filled with either warm or cold water. Then we follow the COWS acronym. C, cold, O opposite, W warm, S the same. Meaning that when an ear is irrigated with cold water, we would expect to see nystagmus to the opposite side. And when an ear is irrigated with warm water, we would expect to see nystagmus to the same side. So, in the case of the patient that I used, I put cold water in his left ear and observed nystagmus going to the right. Nystagmus is the oscillating movements of an eye with a fast and a slow component. The direction of nystagmus is determined by the fast component. So in our case, the cold water went in the left ear and the eye moved quickly to the right and slower back to the left, oscillating like that. Had I used warm water in his ear, I would have expected to observe nystagmus going to that same left ear with the fast component going to the left and returning slower back to the right. So, in the case of a bilateral cortical lesion, nystagmus would not be observed. Only a general deviation of both eyes to the side of the irrigated ear, so whichever side was irrigated. So for our purposes, the proper nystagmus observation based on the COWS acronym, is going to determine a properly functioning vestibular system. Thank you.
Hi, I'm Nicole Bronick, and I'm here to show you a test of the integrity of the vestibular projections to the cranial nerve nuclei. In this test, the acceleration rotation chair will be used. We will have our patient sit in the chair turning clockwise for 20 seconds. During this 20 seconds, their head will be tilted forward at a 30-degree angle. This will cause the lateral semicircle canals to be in the horizontal plane. In the beginning, the endolymph in the horizontal canal will lag behind. This is due to inertia. The sensation will be that the individual is going counterclockwise. After 20 seconds, the endolymph loses its inertia. It gathers momentum and starts moving in the same direction as the body. At this stage, with the eyes closed, the sensation of rotation will be minimum. So let's give it a try.
At the beginning, we will be in the slow phase of nystagmus, where the eye will slowly drift away from the center field of gaze to the peripheral. At the end, you can see the fast phase of nystagmus, when the eyes will suddenly jerk back to the central field of gaze. At this point, if the subject tries to walk, they will deviate to the direction of the movement.
This patient has a normal response. An abnormal response would be the absence of nystagmus with continued head turn, or the presence of nystagmus without any head rotation.